Hi, I am Dr. Monica Blied. I am a licensed clinical psychologist, adjunct professor of psychology, and the founder and CEO of Basis of Health, a mental health ecosystem designed to expand access to care and skills building for individuals navigating neurodivergence, chronic illness, and stress. I am reading from a script, so if it sounds like I am, it's because I am, just to be able to stay on track within this 12 minutes or less video. At the core of my work is a simple but powerful belief. Mental health care is not just about diagnosis. It should also restore, it should help empower people, and also translate into real life change and skills building that's sustainable for the everyday person. In my clinical practice, I specialize in neuropsychological and psychoeducational assessments for ADHD, autism, and specific learning differences for both children and adults, but particularly for individuals who have been misunderstood and misdiagnosed across settings. But what makes my work non-traditional is how I extend psychology beyond traditional clinical settings and into everyday life and into systems that shape people's experiences. I'm going to share my screen and share with you a preview of the Faces of Health app, which is live in app stores and is free and will be forever free. As soon as you open it up, it's just, no login screen, just go straight to the different resources. There's education and tools, body-based skills, so somatic therapy exercises, breathwork and mindfulness, faith-based exercises, being culturally congruent and sensitive to folks from the Christian faith background, in particular, executive functioning skills, because those are typically impaired by people who have chronic stress, who are living with different aspects of neurodivergence. Audio files are available, journal prompts, and more. And I'll just dive into one of these, for example, education and tools. Their CBT skills, psychiatry, featuring Dr. Kerry-Ann Williams, who is an African-American psychiatrist on the East Coast. Sexual health, featuring videos from a PhD level sex therapist. Tools for substance use and trauma recovery. And under each of these categories are tens to dozens of videos that are 2 to 3 minutes, sometimes up to 4 minutes, and lead people through the exercises that are going to help with their everyday living, anxiety management, and stress reduction. And with each video, as you can see, there's also like a little message, a little encouragement there. And I'll just play this as one example.
So what I'd like you to do is place one hand, perhaps your right hand, put it on your chest. Take your other hand and put it on your belly. Go ahead and take a deep breath.
For individuals, this increases access to care, access to the skills and tools that they would otherwise only get if they were working with a highly skilled clinician. And the beauty of this is that I've had therapists adopt this and use this in session with their clients and also assign it for homework. For organizations, this app and its resources provides a scalable way to support mental health and reduce barriers to engagement. I've also developed some self-paced courses. This one is for adult ADHD and autism modules with 17 different videos, very quick skills building videos for executive functioning mastery. I designed this with the busy adult learner in mind. So although there are several different modules, each one is broken up into 10 to 15-minute segments. Each video includes both didactic education and experiential learning, practical exercises to try. And then what you'll see is for each of the courses, there's also free ebooks that are included. Similarly, there's a beat stress using neuroscience and mindfulness course. Altogether, at this point, I've had about 86 users for the online courses. So what was the point? Why do we do this? Because these courses translate complex psychological science into practical, structured tools, not just for individuals, but also for institutions who are seeking to better support neurodivergent and chronically ill populations. So, as far as a multidisciplinary impact, my work sits at the intersection of psychology, medicine, education, and community health. I do serve on the medical advisory board for Lupus LA, helping to integrate mental health into chronic illness care. I myself have lived with lupus since 2012, and so this cause is definitely near and dear to my heart. And I recently developed their patient education guide, a brochure for mental health and lupus. I also partner with the Jonathan Foundation, providing comprehensive assessments for individuals who would otherwise not have access to this. I also teach graduate level psychology courses at Pepperdine University, where I train future clinicians to think beyond traditional models of care and apply psychology in culturally responsive and real world ways. Earlier in my career, I led interdisciplinary healthcare initiatives within the VA healthcare system, including as a program manager for health promotion and disease prevention, including launching the Whole Health program for the VA where I was, and coordinating large-scale health promotion efforts impacting tens of thousands of veterans and staff. Across all of these roles, I bring psychological science into systems, healthcare, education, and workplace environments so that support is not left solely to the individual to navigate. My work has been recognized through leadership, scholarship, and service-based awards, including the Distinguished Leadership Award from the California Psychological Association, recognition from the APA, Society for the Psychology of Black Women, and multiple fellowships and grant-funded initiatives. I've also been very honored to have been selected in several business accelerator and innovation programs, including most recently the Goldman Sachs 1 Million Black Women Black in Business program, the Black Ambition Accelerator led by Pharrell Williams, and also the Black Business Excellence Technical Training Program. At the same time, much of my current work, particularly in these digital therapeutics and organizational training, exists outside traditional recognition pathways within psychology, which is where I believe innovation is most needed. Now, as a neurodivergent African-American psychologist living with chronic illness, I bring both lived experience and my clinical expertise into my work, into a very happy marriage to be able to support my clients and further out into the population through these courses and app. Many of the individuals I serve have experienced misdiagnosis, medical trauma, medical gaslighting, and marginalization across healthcare and educational systems. So my work focuses on shifting that experience and the internal narrative that has been developed because of these discriminatory experiences, helping individuals to develop an understanding of themselves that is accurate, that is also affirming and actionable. I'd like to just screen share a few testimonials that demonstrate the impact of this work that I've done over the short time in my 9 years since graduating, still an early career psychologist. But this impact is not just reflected in clinical outcomes, but in feedback from individuals and organizations who describe increased understanding, improved support, and meaningful change in their daily functioning. Dr. Blied's comprehensive assessment was, without question, one of the best decisions we've ever made for our family. It's quite a long review, and she goes on to say that I normally don't write reviews, but I'm sharing this with you. If you're reading now, you may be searching with the same urgency and love that we once felt. Reach out to Dr. Blied. Our family feels truly fortunate to have worked with her, and I hope yours finds the same clarity and support. That's in my direct clinical work, but if we go to the Faces of Health, main page, you'll see some testimonials of individuals who have experienced the app, including Dr. Vanessa Abernathy, who is a psychologist at USC. She said, Dr. Blied has created a space for self-care, self-treatment, self-help, and so much more. The opportunity for education and community all lie behind the icons of this app. It is an answer to prayer for those who suffer from chronic pain or anxiety or depression, etc., and an inspiration for other mental health providers to invite others away from the noise of social media and make the most of technology to help us all recover, heal, grow, and thrive. I highly recommend you to join me in my use and prescribed use for others. I also want to briefly share with you the cultural and community aspect of these innovations. I'm trying to be humble, but I'm also super proud of this work and its impact. My work is deeply grounded in the communities that I serve. Through partnerships with organizations like Lupus LA and through Faces of Health, I center culturally responsive care and representation, particularly elevating physicians and psychologists of color. And so if you'll go through the different segments and features within the app, you'll see that those segments are all led by Black women doctors. And that's something that I am especially proud of. Representation shapes access. It shapes trust and engagement. And I have intentionally embedded that into both the content and into the systems that I've built. So in closing, across clinical care, digital tools, education, and organizational partnerships, my work reflects an effort to expand psychology into spaces where it is more accessible, more culturally responsive, and more integrated into everyday life for individuals and also for the systems that support them. Thank you for the opportunity to share my work.